For this session, we have Mr. Taffy Mazigana, who is the co-founder and CEO of Vimbo Health, a self-guided app for depression and anxiety that's tailored for South Africans and aims to be stigma-free and affordable. Vimbo Health works with practitioners to help get their clients feeling better through home-based learning and partnering, whilst uplifting the practice with better case management, insights, as well as reporting. Taffy's journey in mental health began after seeking help for his own difficulties whilst living in the UK. There he experienced firsthand the effectiveness of digital self-care as a form of treatment in his own journey, which led him to be passionate about making localized options available in South Africa. Our next speaker for the session is Ms. Sherry Steyn, originally from Durban. She's a psychology researcher and practitioner with over 6 years experience specializing in behavioral interventions, including applied behavioral analysis and CBT. She has experience in adapting and delivering interventions for face-to-face group, telephone, as well as computer-based modalities of CBT to diverse populations, having worked in services across London with the NHS. Whether you're a healthcare professional, a policymaker, or simply someone passionate about mental health equity, we hope tonight's session leaves you inspired and informed. Thank you for being with us this evening. Let's dive in. Over to you, Taffy and Sherry.
Hello, thanks so much. Hi, Sherry.
Good evening, everyone. Thanks, Taffy. How's it, everyone?
I do not want to get in the way of Sherry giving you her greetings. This is a really exciting webinar for us because we believe that empowering you is really a big part of the success or lack of success of digital health tools in South Africa. Whether we like it or not, people are embracing digital health tools. And I think it's important for practitioners to be empowered with the knowledge to be able to advise people what's safe, for example, and what's not, and just to be aware of what are the differences between different tools, because of course it can also be overwhelming for practitioners. I can guarantee you a lot of people are using, for example, of course, ChatGPT in ways that perhaps they're not aware whether it's safe or not. So it's important for, I think, practitioners to be able to guide people in a way that's effective and helpful for them overall. So as mentioned, I'm Taffy and I'm the co-founder and CEO of Vimbo Health. We are a digital mental health app based in South Africa and made for Africa. And just briefly introducing myself, my background is not as a practitioner. I am someone who worked in finance. I lived in the UK and I was just lucky to stumble across very literally stumble across a link that offered me to self-refer for mental health difficulties. The first time I had seen it looked so easy, so I clicked on this and I was offered that I could have face-to-face therapy, I could have group therapy, or I could try a self-guided digital therapy that they were using there in the UK. Due to just being afraid of the topic, I did choose the self-guided digital option. To me, that was not what therapy looks like, but it was very effective. And I was able to recover myself from severe anxiety and depression just by following this tool. So I was super amazed, super bought into the idea that help is something you can get early and it can be effective. But of course, I was left wondering who's thinking about the African context because, of course, I did in some ways feel like an accidental user. You know, I had the great outcome, but they didn't really have me in mind at the time of development, which is fair enough. So that's what led us towards thinking about Vimbo. And I'll let Sherry introduce herself.
Thanks, Taffy. Hi, everyone. As already mentioned, my name is Sherry Steyn and I am originally from Durban, South Africa. So I did my first degree at Rose University and then went on to specialize in clinical and community psychology. So unsurprisingly, that really drew me to CBT. I find it a very empowering type of therapy with lots of ways to use. So that led me to then specialize in thinking about how we deliver different forms of CBT to different types of community. And as Taffy already mentioned, of course, being very passionate about mental health, Taffy shared with me. We're friends. We're all friends. So let's ask ourselves there, Tuffy. We're old friends. And we were just having a discussion about our experiences. So Tuffy sharing with me his experience of being a service user. And I happen to have been working in this type of service he had received treatment through. So really helpful for me to have that kind of conversation. And of course, as Tuffy mentioned, our first question was, okay, yeah, but who's doing this for our people? And that was 5 years ago. And here we are, guys. This is what we do. So hopefully we can share with you what it is that we've done to take these really great digital interventions and just make them a little bit better or more suitable for our kind of environments and people. Thank you.
Excellent. Thanks so much, Sherry. So our agenda today is that we are really big on awareness and training generally. So we're going to give you an understanding of digital tools generally, even outside of us. Just a greater awareness. We're, of course, going to focus on the mental health space. We are going to focus on the research aspect because we believe clinical evidence is super important. And then we are going to give you an idea of the digital health intervention we know best, which is our own. So that's the one we can really explain to you as a case study and example of how this can be relevant for you. And of course, yes, as was mentioned, we are going to have the Q&A. So please do drop your questions freely in the chat and we'll be able to get to those when we get to the Q&A session. So that'll be awesome. Okay, so I'm going to proceed to share my screen. Please bear with me for one moment. Okay. I trust you can all see my screen. Sherry can confirm to me that the correct main screen is showing. Awesome stuff. So that's our topic of conversation. And as mentioned there, I'm going to dive straight in to create some context for you. Because when we think of digital health interventions, whether it's in the mental health space or outside of the mental health space, there is this certain special category which we term digital therapeutics. That can be in the area of musculoskeletal health, for example. It can be in the area of mental health. So the first thing that I want to do today is to just give you an overview of this specific category so that we understand that well, as it's going to frame a lot of the conversation going forward. So a digital therapeutic is, of course, something having that objective to treat. And if we look at the definition that we're given by the Digital Therapeutics Alliance, which is a thought leader globally for digital therapeutics, there is a handy way to develop this framework of thinking about digital therapeutics because, of course, this objective to treat creates the confusion sometimes and the lack of willingness to use because it then sounds a little bit too risky, but it's risky because perhaps there isn't the framework and the way of thinking about it. So we at Vimbo love the DTX Alliance. They are friends of ours, and we do like this definition that they put together. We're not going to read through it word by word, but we're going to focus on specific aspects. And of course, you're free to visit the DTX Alliance for more information and tools like this. So looking at what is a digital therapeutic, it is a software intervention. So that's a critical component, of course. And that software intervention aims to prevent, manage, or treat a medical condition. And it's important to also remember that digital therapeutics, yes, can be used independently, but they can also be used in concert with ongoing care. So there's this idea, of course, sometimes that digital is in competition, but actually the C stands for complement. It's a complement to ongoing care and ongoing processes. So that's a big thing to consider. Another one to consider if you're assessing a digital therapeutic in mental health or not is to just ask the people involved, what have you done to consider the regulatory environment? It's going to be different in every country. Some have higher requirements, some have lower requirements, but really you want to check that this particular intervention has thought about what is the requirement in the local space. And then lastly, you are allowed to be greedy because digital therapeutics are also designed to serve you. Yes, we primarily want to empower patients and get patient outcomes, but you are allowed to consider whether a specific intervention is integrated into healthcare providers. Is it going to assist you with your reporting to your insurance client or a corporate client, for example? You're allowed to think like that and to also expect certain things to be provided to you as people within the healthcare pathway. So this is a really lovely definition. Screenshot it, visit DTX Alliance. It is really a nice framework to consider any intervention. And so I have some maybe shocking or not shocking news, which is to say that for South Africa, we are incredibly behind in our adoption of these interventions. It may seem as though, oh, this is new and scary. Let me wait until 2026. But I'm here to tell you we are 5 to 10, if not more, years behind in terms of taking advantage of these opportunities. And unfortunately, we, of course, need them most. I'm going to give an example, which I love to give, which is the UK National Health Service. These are Sherry's former employers. And in fact, the Improving Access to Psychological Therapies division called IAPT is where Sherry used to work. And within this division in 2019-20, they had, as far back as that, imagine, they had 1.2 million referral start treatments. So IAPT, for context, was set up by the UK government with an objective to treat common mental health difficulties at scale. So there's a real focus on depression, on anxiety, and how to treat them at scale. So I show you the 2019-20 numbers, not because I don't want to update the slide, but because I was one of the 1.2 million people who was referred by myself actually into these services. In 2019-20, 0.6 million people completed treatment in that year. Of those, 51% moved to recovery. So again, I was one of those 51%. So it might look like a percentage, but here I am with the outcome. And almost a tenth of those people were able to complete on a computer-based modality, which meant that they were able to get their full needs basically from that particular type of help, which of course means more people can get help. So I show you this so that you see the numbers, but you also see me here as a proof case that this is effective and it's being done already at scale. Right, which leads us on to our next section. Of course, we can share more by helping you to understand now digital mental health. So that was digital therapeutics. That can be in any area of digital health. But now let's dive into the mental health scene. So we are at Vimbo Health having an objective to create digital therapeutics for mental health that are intentionally made for Africa. So the African user is not step 5. The African user is in fact the genesis of this, and that's our goal. You've seen me, you've seen Sherry. It would be only fair for me to make sure that you've seen Bernard, who's our amazing other co-founder, our technical co-founder, and he's been building tech out of Nairobi for all of his career. So even from a technology perspective, we must consider that it's made for Africa, because I think in San Francisco, they're not thinking about what happens when there's load shedding. But of course, Bernard is thinking about that and making sure people can still access their treatments. So that's super important to us. Okay, so looking at the mental health space, how do we define a digital therapeutic? How do we even define where mental health interventions fit in a person in a patient's journey? So the way we like to think about it is just really understanding the landscape as it's most commonly understood today. That on the far left, there are screening interventions, there are wellness apps. So for example, it can be a meditation app. It can be just a general wellness app. Even some chatbot-based apps fall into this wellness aspect, and that's because we're aiming at prevention. We're aiming at generalized well-being support without making any treatment claims. It's often the case that most people will assume that if a person needs more than this level of help, that they should transition to a form of what we call high-intensity treatment. So medication is a commonly used form of help. Inpatient care in South Africa, 86% of the public mental health budget is spent on inpatient care. In America, that's only 16%. So it shows this over-reliance. So of course, inpatient care is a big one, in-person therapy, and of course, teletherapy then also fits into this category. It's of course a change of venue, but it is still in this realm of this type of help. And now these types of help are amazing. We need more in the area of wellness. We need more in the area of people being able to access face-to-face therapy if that's what they need. Unfortunately, for some people, of course, there's going to be that stigma, that fear of talking to an individual, which can result in avoidance. And then for even arguably more people, I don't have the data on that, there's going to be a barrier of cost. So just sheer affordability. And those two and other factors combine to mean that actually 92% of people in South Africa are in no form of help. And then this is where we start to understand the opportunity presented by a digital therapeutic like Vimbo, because a digital therapeutics is able to provide a treatment level of help in a low intensity manner, often through the person's own interaction with the platform, giving an opportunity for clinically valid treatment that carries less fee and less cost. Again, going back to the definition of a digital therapeutic is part of a person's journey. So it's not to say that Vimbo now exists, all other forms of mental health support are no longer needed. That's not the case, but it is possible that a lot of people actually only ever needed this low intensity level of help. And then if we take those people onto a different type of intervention, we're allowing for the focus to be on those who need the higher intensity. And also, if somebody starts their journey on Vimbo and they don't have the outcome, it means they're more open to now a face-to-face therapist. They understand mental health difficulty and they have more of the language to go to that next level of help. So we are still part of the journey and we're making sure that people are getting an appropriate level of help that's more affordable, essentially. So I'm going to hand over now. Just one thing is to say a digital therapeutic, as you can probably assume, has a higher bar to meet than perhaps a meditation app. Again, meditation wellness apps are amazing, but we do have a higher bar to meet. Similar to your paracetamol that you might take over the counter, you would hope that someone has thought about how safe it is before you put it in your body. Not that you would worry putting it in your body, but we of course make sure then that we are also safe to use in the ways we must be safe, which means we're, as a company, licensed there under SAPRA, and we are POPIA compliant. So we've had a lot of work done around that. So now I shall hand over to Sherry, who will share more.
There I am. Hi, everyone. Thanks, Tuffy. So I'm going to share what we're doing on the app, and then I'm going to also try and link that back to that definition that we got from the Digital Therapeutics Alliance. So let's start by looking at the app. What we're going to be seeing on the screen now is the first stage in registering with the app. So the very first thing that we ask people to do is to complete a series of psychometric measures. Specifically, we use the PHQ-8, the GAD-7, and the Work and Social Adjustment Scale. We've chosen those three scales because not only are they great measures for symptom levels in terms of common mental health difficulties, but they also allow us to measure outcomes. So if we're thinking about reporting, that's really helpful. These are well-established psychometric measures. Now, what's really important is, as you can see on that screen, after each measure, the user actually receives a little bit of feedback about the measure. So we don't talk about diagnosis. We tend to focus on symptom levels. We're thinking about the level of your symptoms and where they fall within a healthy range. Thanks, Tuffy. Moving on. So those measures, which we administer in the beginning and every 2 weeks, allow us to create bespoke content. So as you can see here, the content is broken into different skills areas. Those skills areas are based on what we believe the user needs from those psychometric measures. Okay, each of those skill areas is then broken down into further modulated, if you will, into little chapters, with each chapter being about 5 to 10 minutes. You can read it, of course, if you like, but more importantly, you can also listen to it. So also thinking about different ways that people learn. Okay, so thinking about that, I also want to mention that it does mimic a face-to-face session. And what I mean by that is if you've been watching the screen, you'll see that the users introduced, just like a normal session, we'd review what we've learned, we'd introduce a rationale for the new skill, we'd enter the psychoeducational part, and then here at the end, the most important part, we actually get the user to really focus on real world practice. And that's what they're doing at the end. So we introduce a practice exercise, and they carefully plan and schedule when they're going to do that practice exercise. And this is a major focus, not just for CBT, but for us as a digital intervention, is really thinking about how we deliver these types of therapy in this particular modality. So really focusing on this real world ability to practice the skills and techniques. So thinking about that, what we've done is we've created a series of interactive tools, so digital tools that really allow the user to not only practice. Oh, thank you, Bronwyn. Too much coffee. It's still very early here. Not only allows the user to practice what they've learned in the session, but it also prompts them to any other tools that they might need. So what we're seeing here is specifically the 5 areas model. Now, usually the 5 areas model would be a separate tool. This is based on the CBT thinking of the environment, your feelings, your behavior, your physical sensations, and your thoughts. As you can see, it creates that cycle. But what's really great that we've done here and that you might not have in therapy is we've taken them straight to something called thought court. So we immediately are, again, integrating this model into that real world approach. So really taking them immediately to the next skill. Thought court, if you're not familiar, is a form of thought challenging. So all the time we are thinking about that CBT model and how we integrate it into this particular type of technology. And that's what really allows us to work quite well. So again, this is one of multiple tools that we have. One of the things that I kind of wanted to add on from Taffy is when we think about digital interventions and therapy in general, we don't just want to think about what works, we also want to think about preferences. So thinking about that digital intervention, digital alliance definition, beg your pardon, we're thinking about empowerment. So we're not only thinking about how do we empower you as the practitioner by having the option of giving people more choices, but we're also thinking about simple things like preference. Okay, many users simply just prefer this form of therapy. Okay, all right, Taffy, can we move on to the next one? Excellent. So here, this final screen, this is just allowing you to think about settings. What's really great about what we offer is we haven't just thought about the metaphors, the types of tools and the technical design. So thinking about data inputs, thinking about having access to electricity all the time. So we have the app is completely available offline. So we're very low on data, and everything you can do on the app, you can do offline. So that's really crucial in terms of accessibility, especially in rural areas. Again, thinking about that and what makes it special, look at that language preference. So what's really key about us is that we have thought not just about language in terms of the actual delivery of the psychoeducation, but we specifically offer this in 4 languages at the moment. So you can see we have it in English, Afrikaans, isiZulu, and Sesotho. That is something we will continue to expand. Most crucially, Taffy's already mentioned this, the Digital Alliance really focuses on this. And indeed, I think any clinical intervention absolutely needs it, and that's research. One of the things that we were aware of was not just that there was a lack of products being made specifically for the Southern African region, but actually that there was a lack of research in general. So we really wanted to not only make sure that we were sticking to a really scientific approach, but we also wanted to fill that research gap because, as Taffy mentioned, it really is not just about empowering the community, but also empowering healthcare providers. The one way that you can know something works is it's got a good piece of research attached to it. So with the support of the HSRC, so getting ethical clearance through there, again, thinking about keeping it ethical. So there we are. Thanks, Taffy, getting ahead of myself. We also partnered with the South African Depression and Anxiety Group, which I hope you're all familiar with. Very important again. So always thinking about empowerment and really embodying, embedding ourselves within the community. So with that support, we were able to do a small scale pilot. So this is a general community pilot, meaning that we put ads out to anyone who was interested in supporting their well-being or mental health through a digital app. And this is what we managed to achieve. So having recruited 114 participants, 2 of whom withdrew for personal reasons, we started with 112 individuals. The mean age was 35.2, but I really find it important to mention that our participants were aged 18 to 69. 18 to 69 is really important because I think one of the hindrances with these types of interventions is the assumption that they're for a certain type of person. In our research, we have not found that. So we managed to achieve a 69% retention rate based on a 2-week measure. So that means everyone had to be on the app for a minimum of 2 weeks. Reason being, that's considered the minimum dosage for us. So we would expect to see results even after 2 weeks. I really want to focus on that 69% because one of the things that is, and this is again, very frankly about digital interventions, they can be tricky in terms of retention. Sometimes that convenience can actually be a bit of a barrier. So we're really pleased with those results because 69% was really high, especially for a pilot study. But most importantly, you want to know, well, did it work? So Taffy, thank you. If we focused on the clinical cohort, that is to say those people who at the beginning of their treatments had symptom levels that were above average, so at the clinical level, okay? We managed to get a 52% recovery. And we focus on the moderate, you can see we kind of split that into the clinical group and then a severe group. Reason being was at the time, digital interventions were not being suggested for people who were presenting with severe depression or anxiety. Having said that, though, as you can see, we managed to still achieve a 41% recovery. And this is very much in line with what we're seeing more broadly, where it might not be that people who have more severe symptoms are able to recover completely, but it is still showing really promising signs in terms of allowing them access to early interventions. So 52% recovery, something that we have since been building on. Thank you, Taffy. I wanted to give you an idea of sort of what that progression looks like. So this is one of the charts that we have access to on our dashboard. This for us is what we would consider a very average progression for a user. So we can see this user has started above that 10. 10 for us is what we consider a clinical cutoff. So within the psychological thinking, that mark of 10 or above suggests that there's potentially a mental health difficulty going on. Those levels are too high. So as you can see, this user has steadily, as they've worked through the treatment, reduced those symptoms. This is another reason why we use those psychometric measures, because the user themselves is actually able to act as their own therapist and see how when they engage with the app, their symptoms improve. Thanks, Taffy. Okay, so let's give you a rough idea of how users actually engage with the content. So what we were seeing in the depression group was the module, so the mean average was about 70 pages. So we, again, really pleased with that. I also want to mention that this was off the first version of the app, so the very first version of the app we created. What's really great here is the numbers for the anxiety group. So the anxiety group, I just want to give the caveat that it was a much smaller group than the depression group, but we did see a larger engagement with the content in the anxiety group, possibly because the tools, so a lot of meditations and breathing exercises, but that's something that we'd really like to explore more. Thank you, Taffy.
Thank you, Sherry. And so the outcomes that we obtained from the research obviously were very exciting for us. But we always had this vision to improve on the outcomes. So the retention rate, the recovery rate, are some of the things we obsess about. And so we believe that that localization will get us there and will create a better experience for our people. So it's always fun to remind people, as Sherry mentioned, where we started and that those outcomes were achieved on our initial version. And to us, it really spoke to the quality, or to me, I should say, because I'm going to give Sherry a lot of credit here. It spoke to the quality of the program, that it was achieving those outcomes. And of course, we've been very fortunate to be able to upgrade our platform. taking all those learnings, which were from here, to create a better experience, to provide those local language options that you saw, and to really start to think about what are the lived experiences that are most important for our people here, and to start to build pathways around those. What's always fun for us is when someone contacts us to basically share their journey and what they found meaningful, especially from that localization. So this is a particular user who 53 years old. So some people might say this is not someone who will resonate with the digital offering. As Sherry said, from 18 to 69 in our actual research, we were helping people. And we were able to help this person to a recovery outcome. They were very heavy in terms of their use of the tools of the app, which is amazing. And of course, they read about 80 pages of content and are still most likely going strong. But I wanted to share with you what this user felt in terms of, we talk about language, but really what we've created are cultural pathways. We really thought about how does this concept relate in the cultural context of that language. So I'll share with you that user's own journey.
I was first of all extremely impressed with the fact that I got...
Sherry, you can confirm for me that you can hear the audio?
Yes, I am able to hear the audio. Thanks, Taffy.
Fantastic. Thank you.
First of all, extremely impressed with the fact that I got to know that this is a uniquely, proudly South African app. That blew my mind away. The fact that there is 3 language offerings, Sotho, English, Afrikaans, and isiZulu, obviously, to me, is so forward-thinking. It is fantastic to do that in your mother language. Many of us, when it comes to mental health, don't necessarily understand all the English wording. We are also not familiar with the mental health sector, and then to get the opportunity to go through this journey in your mother tongue takes away all the anxiety, all the pressure, and all of a sudden, you actually get a better understanding of what it is that you need to manage. I had mother tongue education up until tertiary education. And now that I can have assistance with mental health challenges and I can have it in my mother tongue, it even gives me a sense of security and safety. I don't have to keep on rethinking the difficult English words that are being used. It calms you down and it helps you to progress quicker. If I didn't have my mother tongue available in Vimbo, my progress would not have been as good as it is, because I would be struggling with a language in a very medical sector with words that I wouldn't have understood. So there goes the whole idea of Vimbo, if it is only in English. No, this is the best thing that I was ever introduced to. The app's ability with all the tools. I've never, ever have seen anything like this before. I'm quite sure there is international apps like this, but this is for Mzansi. This is our app.
Amazing. So what I always love, actually, that's probably the favorite part for me, but a very close second is, of course, when we start talking about how we all come together as local stakeholders to really get the impact that we want to see. I think we're taught a lot what we can't do, but I think we're very good at coming together and uniting and making a plan. I mean, you should see my neighborhood WhatsApp group. Any problem that happens, people come together. And definitely within mental health and digital health, it is a team effort. And I really love this overview from the Digital Therapeutics Alliance, which really puts the patient journey from a perspective of the stakeholders that are involved in the patient journey. And I'm here to also tell you that nothing happens, well, less happens, very little happens without the awareness of you all. And you're obviously amazing in your care for patients, in your ability to explain or to understand what someone might need. So it has been seen by us and others that the awareness of the community is extremely important if we're going to have any outcomes at all, which is why we love doing these events. Another is seen generally is that the immediacy of help is super important to the outcome. In Vimbo, we call it the 5 minutes of curiosity. Can we take advantage of that moment where that person had an inkling to explore getting help before they lose it and then maybe come back in 2 years when things are worse? So the ability of a person to walk out with a working model has been seen to be critical to the outcome at the end. The ability for a person to have that orientation, understanding of what the platform is, how it works, has also been seen to be important. And then lastly, of course, how do we keep that engagement to a sufficient level to be able to get the outcome? So the outcome in our world is the main thing. We're not a forever app. We're really trying to get the person to be well so that ideally they don't need us because they're really functioning in the real world where we want them to. So yeah, so you definitely play a major role, and so excited to see you join this because you are helping to fill that column, which is number one on awareness and so forth. So I can talk to just two things we do. We obviously are active in filling the rest of this map, but I'll focus on two areas. The first one is this idea of the immediacy of help, because what we're really trying to create is a scenario where for this individual, there is no longer a waiting list involved. They can go from that curiosity to a form of treatment within 5 minutes. And really what we've done around that is to have a onboarding process that we've intentionally worked on to make it very unintimidating, to make it quick, to make it very responsive and easy to get on and for the person to get started. We do have pathways whereby an insurer, for example, is paying for the access, perhaps a life insurer, but we allow also for people to come on directly onto the app. I'll talk about pricing later because it's always a question. But the idea is that we're able to give someone something affordable, something that they're less likely to be afraid to take on, so that at least we can get them to start the journey. So we've done a lot of work around that. And as you saw when we showed that mapping of how we fit in along the journey of an individual, it's possible that the person is going to be more enlightened, they're going to have the language, but in fact, they're still going to need a high intensity form of help. We believe that the next person in the journey of care shouldn't start from scratch. Why should they? We allow the individual to themselves invite a supporter if they would like to. That can be their psychologist, that can be their psychiatrist, and then that individual is able to see the person's journey through the Vimbo app. They're able to see what tools they've interacted with, what skills they've tried to build, and critically how their symptoms have progressed over time. So we really do believe in uplifting the system as a whole. So we've developed these tools that enable practitioners to also get involved in journeys where it is relevant for them to do so and where they have the POPI consent from the individual. This excites me because this is a real but anonymized user, and you can see this individual was struggling with severe anxiety, and they were able to get that outcome from using the app. So that's a tool we're really passionate about. So yeah, we're really about these, the opportunity for the person to, yes, get help, but if there are needs for other people to be plugged into their journey, then they can do that. So we'll just let Carla share her experience.
With my clients, and I know Tafi, I've shared this with you as well. I have had a decrease in symptom severity, and it's so amazing to be able to have this tool, this dashboard for a practitioner to refer back to, that sort of measures your client this every 2 weeks, that you can go check in on, see how is it going with their scores, is what they are reporting to you and what is being objectively measured the same? Is it consistent? So that's been what I've seen a really nice tool. And with my clients' experience, what I've really seen, once there's been a completion of the program, there's been a reduction in symptom severity, which is really, I think, the point of all of it. So that's really been amazing to be able to see that.
Thank you. So as we mentioned there, look, clients can just download this directly, but those who are interested in having a practice account can set one up for free. So for example, Carla's practice set up the practice account at no cost, and then from there they're able to provide this access to their clients at 1 to 90 and either recover it from them or from another type of payer. So yeah, so if you're interested, that's our website. You can fill your details there. There's no cost for this additional tool. It's just really to uplift your practice and allow you to do more.